Everything rises and falls on leadership. The ability to lead well is fueled by living your cause and purpose. This podcast will equip you with the tools to do just that. Live and lead with cause and purpose. And now, author of the book, The Anatomy of Leadership, and our host, Chris Comeaux.
So what a great month. And so even being a holiday month, it feels like there's a lot of great articles. So next, we're going to go and relook at our 2025 predictions and then make our 2026 predictions. So let's go to the next segment if you're ready, Cord.
Let's do it. Chris, what were your thoughts about your predictions of 25?
Yeah, so it's interesting. I've never done a prediction show before. That was my first time last year that we did that. And so it might kind of take on my predictions, and kudos to you because you actually put it all on a table. I'm like, over the holiday, I'm like, I got to go back and find my predictions. And luckily you had it in a wonderful table. I'm like, I'm not going to squeeze out of these. Cordt's got them actually all documented pretty well. And so I'd say I'm probably maybe 50% on point. One of the things that, as I was reviewing my predictions, and the good thing is that I was able to review yours before I did my 2026, yours in terms of you bringing them back to the forefront. There's a Bill Gates quote that I've always loved. He always said that people, they overestimate the amount of change in 5, and they underestimate the amount of change in 10 years. Now, I think that just that general ethos of that quote kind of comes in doing predictions like this. Like, what are some, because the cool thing is we see these macro trends. I think that, done this show many years now, probably 3 years in total, Mark, before you and I were doing it together, Mark Cohen, you see these macro trends. I think I'm overzealous, that kind of Bill Gates quote, overzealous of what I thought was going to kind of come to fruition in the current year, but probably maybe underzealous over that course of time. So that's helped me modulate my 2026. But here are a couple of things. And so first off, a year of the unexpected. In fact, we got it from Dr. Will Faber. It was going to be a predictably unpredictable year. Kind of, sort of, but not to the extent that people were predicting. I think everyone was expecting a very chaotic year. I think more of the chaos coming in healthcare. The big, beautiful bill is setting the stage that 26 is going to be a bit of a mess. But then I think that's going to get really interesting in the midterms. And I'm getting a little bit ahead of myself as far as the predictions. But this is a perfect example of maybe a little bit overzealousness in my prediction. Now, the next one, United Healthcare's problems are going to continue. I think actually I was on point on that one. Their stock lost over 50% of its value. But in December, it started to actually come back. So I think was it 350 and actually gotten as low as like in the hundreds. But then in December, it actually started coming back and I think regained about maybe 30-something% of some of that lost value. So pretty tumultuous year. Their chairman of the board, who was the prior CEO, has come back to United Healthcare. So we'll get into predictions for 2026. Less labor disputes was a prediction. That was probably a little bit on point. Pharmacy deserts are going to get to a crisis point, and the outcry is going to be so great the government's going to have to do something. I over-extrapolated that one. In fact, it's interesting. In fact, I meant to go back and check, Cord, but I didn't have a chance. There's been less articles about pharmacy deserts. And so I don't know if that's just because the articles are not as prolific, but a lot of places in rural United States, et cetera, there are truly pharmacy deserts, but it hasn't come to some like major crescendo. Is it going to kind of probably be part of the big, beautiful bill turmoil conversation? Hopefully. We're going to look at it kind of holistically. Human composting as a burial alternative is going to start to take off in 2025. It's a little bit more, but certainly not where it's exponential in any way, shape, or form. In fact, I saw some recent data that I think it was the millennials or Gen Zs that viewing is actually really important to them, which is kind of interesting because that's hard to do a viewing if you're going to do kind of composting or some type of cremation. So a little bit of mixed bag of things I've seen there. More predictable things, staffing shortages, financial pressures, technology, fast pace of AI, all of those things. Yeah, I think those are kind of were on point, but those are probably easy predictions. Medicare Advantage is going to be in the headlines a lot this year. Yeah, that was actually pretty correct, but that's such a major kind of trend. Cyber threats was a thing I was saying will continue. Obviously, it certainly does continue, will continue, going to probably even accelerate because artificial intelligence makes it easier. Here's one I missed. The private equity debate's going to reach a crescendo this year. No. Yeah, more highlights on private equity, but I think that because of multiple maybe conflicts of interest, I'm not so sure Congress is interested in kind of pushing that to a head. But the good thing is, I think articles are pushing it to a head, like people are bringing it to the forefront. Maybe in the big, beautiful bill challenge of this year, maybe that'll be part of the dialogue. More innovative, creative collaboration and partnerships. Partially, it should be, and I love that you actually had a comment back to me. It really should be more needed, but I wouldn't say that we saw this huge crescendo. I give myself maybe 50%. Some were good. Some I was overzealous in my predictions. How about yours?
I think along the same lines. I had envisioned big things that were going to happen, and I think really what was perhaps most surprising was that we had incremental changes in many different areas, but no huge crescendos, as you said. So the first one that I commented on for 2025 was an important focus on hospice quality. Of course, I was thinking the HOPE tool in mind, that this was going to be it's a great idea, but the implementation was going to be a train wreck. Hospices weren't going to be ready, too much change. I was wrong in that. It actually seemed like hospices were quite prepared. And I hear kind of hallway conversation, one-off comments like, well, we struggled with this or we struggled with that. But overall, it was implemented much more smoothly than I was expecting. So I also kind of balanced the quality against, well, how much waste, fraud, and abuse has been in the news? There's been some. This was not the year of Ava Kaufman's ProPublica article. This was not the year of the OIG in 2019 doing two full reports on hospice and fraud and problems. And it wasn't. I think quality from the positive perspective really outweighed the coverage of waste, fraud, and abuse in the hospice. Again, kind of a gestalt and overall view of that. My second point was around hospice utilization will continue to increase. It has. I think we're back on track with pre-COVID expectations. I think we're going to see it increase another 1% or so each year for at least through about 2030. At that point, I think we might be, it might be stabilizing around 60%, 55, 60% nationally. My third point, staffing is going to continue to be a challenge. That's low-hanging fruit. That was an easy one. It still continues to be the number one operational concern. Although maybe not as chaotic around staffing as we felt in during the COVID years. I was talking with Joy about this yesterday, and she said, "Oh yeah, you remember all the conversation, the Great Resignation." You know what? 2025 kind of was not that. 24 was, 23 was. So staffing, interesting point. Hospice philosophy of care. I think Dr. Bayok's done a great job of stoking that fire to be talking about hospice philosophy of care and why this is important. We can't lose that mission. We're not just another healthcare sector. Others have also published work and presented and been nudging hospice in the right direction, in my opinion, around hospice philosophy of care and that importance. I think as I look at 26, just a glimpse towards predictions, I think as our economy stabilizes and we're seeing lower interest rates, I don't know what that's going to do for merger and acquisition. Like, I think I was thinking that 2025 was going to be a big year for M&A, and it kind of, but not nearly as dramatic as I was expecting. Maybe that's ahead. We'll see. My last point was use of AI will increase exponentially in 2025. And I would say Not so much. I'm going to comment on that in a little bit. I think it has increased substantially. And we're going to see how this is going to unfold in 2026. But we're not at the point of every hospice has a robot delivering medications at the bedside yet, nor will we be in 2025. But we'll talk about that in the predictions. Maybe that's a segue into what were your predictions for 2026? What are your thoughts around what's coming?
Yep, you bet. And so we've got some good detail here, but just this morning, I think it hit me what maybe my theme might be for 26 or my predictive theme. So as I said earlier, I went back and reviewed all of my summaries for the year. And again, thank you for posting the top articles that were clicked on. It really can help me see from a data standpoint. Here's some interesting things, Cord. So where were we this time last year? So these are just some reflections. And so we were on the heels of Hurricane Helene coming into 2025. We'd just gotten out of a presidential election, and an assassination of the CEO of United Healthcare that had just happened. And then off into 2025. Hard to believe during then 2025, we instituted a new administration. A pope passed away, the California wildfires, and a government shutdown, just to name maybe a few major headlines for 2025. So again, I think my predictions for last year were overzealous. So I think maybe it's tempering me this year. But I think one of the big things into next year as an example is the big, beautiful bill. The implications of it is going to wash on shore. That's going to be happening this year. I know many hospitals are like, we don't know how to budget for this, so we're just going to carry our budget forward and basically, this is my words, wing it when we're in the midst of the storm. Just take that and multiply that times many billion-dollar healthcare systems, ERs maybe being flooded for people being uninsured, et cetera. All in the while you actually have the midterms that's going to be occurring. I think it's going to be, so here's my kind of theme. I think it's going to be a stormy year, but the storm is not going to bring things to that crescendo. It's going to force this is some pretty major issues. What are we going to do about it? Probably some promises made into the midterms that then the actual solution is going to be more 2027 and beyond. So stormy year, bringing some tough things, almost like a hinge year might be another way to kind of say what 2026 is going to be. But more of setting the table for things that are going to then play out in 27, 28. That's kind of my take and kind of maybe sets the stage on all my kind of predictions. So my 8 challenge areas are going to continue into the next year. So the first one, under reimbursement, you're going to see, I think, more models. We're seeing this towards the end of this year. So kind of like during the Biden administration, where we were seeing all these reach ACO, et cetera, we're going to see more innovative models coming out of CMMI. Amidst the DOGE, where they were cutting positions, they were actually staffing up in CMMI, but we didn't see the fruits of that because of the government shutdown. That's going to come into 2026, I believe. The wage index for 2027, which is going to hit about August, that's going to be super interesting to see. Did we learn enough from the 2026 hope? That's then going to maybe something that's then going to be pretty major, dramatic into the index. Here's my prediction. I don't think they're going to have enough data. It's going to be more 28, 29, where then we might see our next big iteration. So again, kind of back to that theme of kind of a hinge year. Medicare Advantage is one of my other big categories under reimbursement. I think we're going to keep seeing growth in SNP plans. But as I predicted earlier in the first segment of the show, I think our high watermark of MA at 55%, you're going to start seeing that go down. Now, how dramatic is that kind of decrease? I don't know. I just think the trend line is going to be going in the opposite direction compared to what we had seen it going before.
Why do you think that is?
Because I think Medicare Advantage, that people are kind of on to the fact now that I've got major health issues. Medicare Advantage is not quite what's the best coverage that I need. Whereas people that are younger, healthier, Medicare Advantage is a good option. Now, people that are more kind of minorities and don't have other health insurance options, that's not totally true. But I see my own family going, I'm not signing up for Medicare Advantage. People that are in the know in healthcare that are now becoming 65 and I'm not signing up for Medicare Advantage. So I think some of those, them learning how to game the system, being the Medicare Advantage, basically coding people via the the RAF scores, et cetera, all those things that give them higher reimbursement. I think all that's kind of been figured out, and now it's getting down to the consumer. And so I think it's going to create a little bit more of a mixed bag, which is why I think it's going to be so I don't think it's going to be like down to 50%. I just think the trend line is going to be like, wow, all of a sudden it's not going up. It's actually either going down a little bit is kind of my prediction. I do think United's troubles will continue. Well, the headwinds are still going to continue. I think it's going to be an interesting year, and I think it could be 50-50. It's going to be really interesting to watch. There's some fundamentals in the commercial health insurance industry that are just kind of broken. I think we're going to see a lot of health insurance increase premiums continue for employers going into 2026, which is going to hit the same time as the big, beautiful bill. So that's going to be part of, healthcare is broken in our country. So how the health insurance companies respond is going to be interesting. I'm not quite sure. I feel like it's kind of 50-50 which way it could go. My next category, competition to be aware of. You maybe alluded to this. I think there'll be less mergers in 26, but the ones you see are going to raise eyebrows because of the people involved. Like, wow, that's some pretty interesting people involved in, rolling up or creating a new footprint or something along those lines. I do think hospices are going to resume growth as the death pull forward for COVID is mostly over. So generally, you're going to see hospices growing more again. And private equity involvement in healthcare is going to come to a head. I wish. No. I do think you're going to see a lot of articles, and it's going to be kind of a crapshoot to see if it actually does come to a crescendo, or is at least part of the, hey, healthcare is broken because of the big, beautiful bill. What do we do about it and fix it going forward? Should private equity have a role in healthcare or not? If we're mature adults, it should be part of the conversation. So that'll be interesting. Workforce, the challenges are going to continue, but people are going to start to realize there's just no quick fix on this. We've even put together a toolkit as Teleos because we think you got to play the long game on this one. Like even looking at your interdisciplinary group disciplines, like what are other disciplines like community health workers, for instance? Like those things are not quick fixes, things that you got to work on in the long term. Because I agree with what you said earlier. It's like it feels like the crisis has abated, but the problem is not going away. Like the resignation, great resignation, et cetera, but it's still hard to staff. In fact, I heard 2 new hospitals, just family members, new hospitals in the area. These new hospitals can't staff because it's a math problem. The needs compared to the actual workforce. And so you've got to work for it the long term. You alluded to this. I agree with you. No robots in care this year. That's more of a 2027, more than likely a 2028 thing. So you're not going to see like this huge confluence of robots being integrated into care in 2026. Really cool thing I harvested in a podcast. Someone was trying to get one of Optus Prime, one of Tesla's early robots, and they said, no, we're deploying every one of those in our factories in 2026. So they're kind of going with their own infrastructure first. So that's another reason why I think 27, 28, 29 are going to become a whole lot more interesting from a robotic standpoint. I do think more virtual reality healthcare training is going to become available. Not a huge trend, but it's going to be like, hey, why would we not do this? In fact, I made a note for myself within Teleos. I mean, you got these VR head sets. What a great opportunity to train people, much lower cost, create more hands-on experience. I think you're going to start to see more of that in 26. Next category, patient family.
Jump in on those two for a second.
Yep. Mm-hmm.
I think some of that's kind of incremental. If we talk about robots, are we talking about, a wheelie thing going down the hallway with a medication tray? No, that's further off into the future. But we've seen Capital Caring put out several articles around robotic pets and dementia programs that have been very useful. And so we hospice are dipping our toe in the water. I mean, we're starting to move in that direction. The same with the virtual reality stuff. True, Community Care in Boulder has rolled out several programs and made a big impact in their community around using virtual reality and the calming, the peacefulness that can bring. So again, we're dipping our toe in the water. It's not every hospice has 15 headsets, but we are dipping our toe in it, and we're I think trying to figure out what's the best way to use this technology.
All said. My next category, patient family demographics. That article I pointed out in the first segment of the show about more use of tech by caregivers to coordinate care. I think you're really going to see that increase. And therefore, that leads to my other thing that I alluded in the first segment. I think Google reviews are going to drive more of healthcare choice, which is kind of crazy. It's not going to the CMS compare as more Google. What's your star rating on Google say? And this is going to be an interesting one. So I will go on record on this one. I do think this one's going to reach a bit of a crescendo, is nursing home woes and assisted living facility woes. A lot more articles, a lot more highlights of a lot of the problems, systemic problems in that segment, and that's going to reach some type of crescendo. Next category is regulatory and political. Medical aid and dying. Mark Cohen predicted this one. We didn't talk about Mark's predictions last year. He said that you're going to see more states, and sure enough, we had New York right before the holiday, I think Illinois. And so in an environment you wouldn't have think with a majority kind of Republican, the whole election from last year, you had kind of the red wave. You would have thought that MAID wouldn't move forward, but it actually did in a couple key states and critical states. So Illinois, you've got Chicago, obviously New York, you've got New York City. So I think MAID is going to be interesting to watch this year. We've never really had a mature conversation as a country around that. Will that provoke some interesting conversations around medical aid and dying? I do think 2 additional states, maybe 3, might have a palliative care benefit in 2026. We have Hawaii, and New York is right on the precipice of something. So I think 2 to 3 additional this year. And we won't have a government shutdown this year. I'm going to predict that. I'll go on record on that one. Next category, tech and innovation. The EMR vendors really start to make some progress this year, the major vendors. So pretty major, interesting things that are coming to fruition right now. And I think there's going to be some dark horse, if you will, EMRs like that are artificially intelligence kind of based that are going to really hit the movement, the field, if you will. And I think it's going to raise some interesting eyebrows. The promise of AI solutions in our space is going to start to increase this year, but be very thoughtful. I think people are going to become more interested in us as AI will make us question, what does it mean to be human? So artificial intelligence, what does it mean to be human? And I think in that, people are going to be more interested in hospice and palliative care because our proximity to death. And our proximity to death and dying gives us a unique perspective about what does it mean to live and what does it mean to be human. So that's a little bit of an interesting, and one of the reasons why is, Daniel Pink was on our podcast last year. Getting Daniel Pink on a podcast was a huge coup. The reason why he agreed? He's like, I've been thinking more about hospice and palliative care. I think along the lines of what I just said. So if someone like Daniel Pink is paying more attention to hospice and palliative care, this might be our time. And here's the last one. It's kind of an easy one. Leadership. Everything rises and falls in leadership. Leadership is going to become more and more important and more complicated as we go forward because starting to lead like teams of AI agents as well as your human being team is going to start creating some interesting new challenges. Now, here are a couple of predictions from Mark and then my executive leadership team, Cordt, and I'll hand it to you. So I did reach out to Mark, and Mark Cohen, he had a few that I thought we wanted to highlight. The Federal Trade Commission will not be as vigorous in reviewing proposed healthcare mergers as the number of announced mergers and acquisitions increased in 2026. That's interesting. Democrats will make the role of private equity in healthcare an issue in many congressional and Senate campaigns in 2026. Reputable media outlets, national and local print, broadcast media, news sources, even trade publications will continue to expose egregious abuses in skilled nursing chains operated by unscrupulous entrepreneurs. And then hospices that care for patients in those facilities will face increasingly difficult choices about how to navigate this dilemma. And then one more from Mark. Small and rural hospitals will continue to pair services, convert to emergency-only service, or close completely. And then the one beautiful bill, big beautiful bill, is going to exasperate that crisis. So here are the last one, Cordt. I did reach out to my senior leadership team. And so here's kind of a consolidation on their predictions. Consolidation, larger programs are going to keep coming together, but you're also going to see some state association mergers across the regions or maybe even being acquired by another association. Hospice technology investment will separate the girls from the women. And so in other words, they're going to have to make technology investments. It's going to start to differentiate the bigger programs who can't versus smaller that just don't have the resources. Less private equity mergers and acquisition due to increased regulatory complexity and uncertainty around the political environment. And for hospices, less focus on aggressive growth and more focus on quality and compliance. Economies of scale hospices will be very carefully considering how they can produce more economy of scale, especially as they need to make these investments in technology. You're going to see creative RN staffing models aimed at flexibility and reducing FTE needs, almost like more virtual nursing services to complement the boots on the ground. Increasing number of homeless older adults moving towards epidemic proportions beyond 2026. More hospice senior living joint partnerships, acquisitions, startups, etc. And the last one, greater need for compliance, audit readiness, and response. That's a lot. So what do you got, Cordt?
That's really thought-provoking. As I thought about predictions for 2026, I think you and I are going to say very similar things with maybe a little bit differently. You used the term stormy, kind of setting the stage as a word picture for 2026. I'll say the same thing, but in a different way. It'll be the year of the duck. What we see is going to be kind of puddling along and looking fairly calm and stable. But underneath the water, there's going to be a lot of action going on that's setting the stage. That's what I kind of think is going to happen. My framework, I'll start with Dr. Ira Byock's strategic categories and then kind of move into a thought, an additional category around technology adoption. So waste, fraud, and abuse. I think the period of enhanced oversight that's been going on in Arizona, California, Nevada, and Texas, I think there's been a lot of work going on in 2025, and we really haven't heard too many of the results of that. I think in 2026, we're going to see some results of that coming out in publications, coming out in hospice closures, hospice rebukes, that kind of thing, particularly in those 4 states. So I think we're going to see a little bit more coming from that direction. And I would balance my comments, at least when I was developing these, I was thinking, well, there's kind of national government, Medicare changes that we might be looking for, but also the personal responsibility side. Like it's easy for me to say the OIG should take care of waste, fraud, and abuse. Well, okay, but what am I doing about that? What are you doing about that? And in that regard, I would throw out some recognition, put a spotlight on Sheila Clark, the CEO of the California Hospice and Palliative Care Association, who has been working diligently at all different levels to address waste, fraud, and abuse in California. And I applaud her. That is hard work to do. And so what other names can we add to that list? There are several other names come to mind of people working to curtail waste, fraud, and abuse and keep hospice moving in the right direction. So I think that's going to be an interesting piece to take a look at. In terms of clinical and programmatic standards, we need these clinical and programmatic standards, such as patient-to-staff ratios and professional credentialing across the different disciplines, and encouraging those credentials and paying more for people who have those credentials. And I mean, we could talk about that a little bit. I think in terms of 2026, I hope we're going to see the formation of work groups to review some of the standards that are out there, to update them, to see where the gaps are and how we can modernize the hospice standards. I see 2026 as being the year, I hope, where these work groups are formed. And so we're not going to see the publications. We're not going to see the outcomes necessarily in 26. I'm hoping we're going to see that in 27. But we're going to be making progress in the right direction with those. And I believe that's what Ira was trying to do with his second article that came out in December, the July article setting the framework was we need to do these things. The December article was here's how, here's who, here's what this should look like, could look like. And it was much more detailed and prescriptive around developing the standards and a call to our organizations, whether that be an individual provider or a state or a national organization, to get to work on this and continue the work. It's not that this work hasn't occurred before. It's time to update it and revive it. So I'm excited to see what's going to happen there. In terms of that personal responsibility, I hope that our listeners are thinking, how can I personally get involved in what's happening in my organization or at state and national levels to ensure the continued commitment to person-centered, high-quality care? Making meaningful data available. I expect that we're going to have expanded insights in 2026 regarding hospice deserts, utilization patterns, and access disparities. We're going to build on tools. We've done some of this with Hospice Analytics and the National Hospice Locator to give a quality score based on a matrix of factors for every hospice in the country. It's akin to the Google star rating of where do you go to receive hospice. So I think we're going to see more and more attention in these areas around quality and making that information available in a format that the public can easily digest. Driving competition based on quality. I think the public reporting of the HOPE tool, Hospice Outcomes and Patient Evaluation tool, which was implemented in October of last year, we're not going to see those results publicly in 2026. That's not the plan. The plan is that we'll see it in 27 when they have a couple of years of data collection, that sort of thing. In the interim, I think hospices are going to continue to differentiate through established quality matrix. We talked about the NHL, but also emerging platforms like Health Pivots, Measures That Matter. We're going to be talking with the Health Pivots folks next week. So looking forward to that conversation. I think there's a lot of initiatives around a focus on quality to help the consumer, help the public find high quality providers. And I hope that does become the differentiator for competition. Lastly, an IRIS framework embracing and promoting our authentic brand. I had a hospice experience in 2025, and it changed how I looked at hospice and the provision of care. And I was telling somebody recently, we can talk about 2 million hospice admissions of 1.8 million beneficiaries, of whom 1.2 million die. We can talk about these trends and break it out nationally and regionally. But you know what? One of those deaths was my mom, and that makes a difference. And I hold that up. I think we're going to see more and more of these personal stories that are driving why we're doing what we're doing. And this is somewhat unique in hospice to our brand. Does our organization provide the level of care we expect for our own family members to receive? So I think we're going to see more of that. In terms of my last point, some attention focused on artificial intelligence. I continue to think about Ernesto Lopez's commentary on hospice's unique approach and this is a white paper he published on the 1520 AI webpage. Chris, an organization you and I are both plugged in with, and he's making the argument that hospices are not behind the curve. We have a unique field and a unique vulnerable population that we're serving, and we're being very deliberate in analyzing and thinking through the benefits and the risks and the trustworthiness we have in those AI vendors to ensure that the hospice philosophy of care is moving forward as intended. We're being very deliberate in how we're operationalizing and integrating AI into hospice. And that's That's good work. That's good thought. We need to be very intentional in that. And so I think we're going to continue to see an adoption of AI, but we're going to pace it appropriately in hospice. It's not going to be the crescendo, the tsunami in 2026. It's coming, but we're patiently evaluating this. We're being deliberate. So I appreciated his perspective on that. So I am excited to see where 2026 is going to lead us and where we're going to lead it. And I'm thinking ahead a year from today, Chris. How are we going to do with our predictions for 2026?
Well said. And I love what you just said, because leaders change the trajectory of things. And so the best way to predict the future is to create it. And hospice and palliative care leaders, we know you're our listeners. So let's go out and make 2026 pretty incredible, because this work that we do is sacred work. Patients and families, especially if it's someone like Cordt's mom getting care, they deserve nothing but the very best. And that's what's riding on us doing our jobs this year. So, Cort, thank you. Thank you for your time today. We hope you guys enjoy this show. Give us some feedback. This is the first one where we're kind of doing the 2 segments. And at the end of each episode, as we're always going to do going forward, we always share a quote, a visual. The idea is to create a brain bookmark about the show, a thought prodder about our podcast subject, just to further your learning and your growth. Be sure to hit the subscribe button. Also pay it forward to your friends, your coworkers. Make sure they know about the podcast as well. So thanks for listening to today's podcast. And here's our brain bookmark to close today's show.
What the new year brings to you will depend a great deal on what you bring to the new year, by Vern McClellan.